Today's module is about improving eye contact. There are certain prerequisites before starting this module. The first, by this time, the child should be able to sit comfortably on his own. Second, the mother and child should be free from distractions. The seating arrangement should be such that the mother and child are sitting comfortably at eye contact level. It is important to choose the right time for therapy, which generally is either the meal time or the play time, but it may differ from child to child. It is also important to choose the right reinforcements, which generally are the child's favorite food items or his favorite toys. We are seeing that the mother and child are sitting comfortably at eye contact level. The mother has a bowl of his favorite chips which have been broken into small pieces so as to prolong the therapy time. The mother has to be at her expressive best. She has to use exaggerated facial expressions, hand gestures and voice modulation to catch the child's attention. Call the child's name loudly.
Ram!
Give the child few seconds to respond. If he does not make eye contact, use the food prompt. As you call his name, bring the chip near your eye level.
Ram!
If the child still does not make eye contact, then use physical prompt like lifting his chin as you call his name.
Ram!
Ensure that a minimum of 1 second of eye contact is made before rewarding the child with the chip.
Very good.
The aim of this step is that finally the child should learn to make consistent eye contact on name calling for at least 10 consecutive times. The time taken for this may vary from child to child. It may be few days, weeks or maybe months. But once the child has mastered this step, the next step is fading the prompt. Mother tries to gradually fade the hand prompt. She may begin with using the palm of her hands. Once she is successful with this, then next step is using the fingertips. Once she is successful with this, the next step may be hand away from face, away from the body, and finally using no hands. This fading may take few days to even weeks. The next step is differential reinforcement. That is, do not reward every eye contact. Rather, reward in an unexpected, irregular pattern. That is, sometimes reward after 3 consecutive eye contacts, sometimes 4.
Ram! 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 Very good.
Once the child has mastered this step, that is, he is consistently making eye contact for at least 1 second on name calling, it is time to move on to the next step. The next step and our next aim is to elicit a 5-second long eye contact. Here, you may have to repeat all the steps which were enumerated earlier, but usually the pace of learning is much faster. Once the child has mastered the 5-second long eye contact, the next aim is to elicit eye contact from the child when he is preoccupied. For example, when the child is playing. Here again, we may have to follow all the steps as brought out earlier.
Ram. Very good.
Once the child has mastered the step of making eye contact when he is preoccupied or busy, the final step is to elicit eye contact from the child from far. Here, we may have to follow all the steps as enumerated earlier.
Ram. Very good.
We have to remember that each child will have their own pace of learning. We have to persist with our efforts.